Cassandra Isidro. I go by Cass, and I work for the Amputee Coalition. I'm the CEO, and we provide support, education, and advocacy for people living with limb loss and limb difference, which is about 5.6 million people across the United States.
Wonderful. I would like to get into, I know you became the CEO, I think, in
2020.
2023. If you could talk to me a little bit about that and share like a brief history of your background and how you got into this industry.
Sure thing. I have been in the nonprofit space about 30 years this year.
Wow.
It's amazing. I was at 23, I became an executive director with the Red Cross and spent about 10 years with them. Had a good time doing disaster services, media, fundraising, all the things. And that really sealed my commitment to the nonprofit space. I went back and got my MBA a number of years later, thinking I would be on a board, but I never left executive positions. I've been able to work for the USO, been able to move healthcare reform and education forward, and now I'm happy to serve those living with limb loss and limb difference.
Amazing. And I'd like to talk about the resources and the type of visibility that you guys try to give for this demographic.
Mhm.
Could you share with us all the resources that you provide and all that good stuff?
Sure thing. Happy to lean into it. As we are the only national organization that's sitting in this space. So 5.6 million people. There's someone today in a hospital who is going through an amputation, and we have a peer support program. So all likely someone in our peer support program is visiting them, someone who has a similar amputation, someone who's gone through a similar journey and helping them move along. We also have phone calls all day long, text, emails of people looking for resources, ways to connect to each other, and ways to get answers to help them in their journey. Our vision is that those living with limb loss and limb difference and the people who care about them thrive in the lives in the way they choose. And so we do everything we can to move that forward. We have a national conference, we have education resources, and then we are constantly in the media and sharing information about what the limb loss and limb difference journey is like.
I think that is amazing. I took a little visit on your website and I saw that you guys have so many resources. You also have the option of like the Spanish version, which is
Mhm.
like so helpful. And then you guys also have like a peer support group too, like where
Mhm.
you guys can meet up and talk about it and share your experiences. Cause I'm sure that sometimes it can feel a bit what is the word for that? Isolating. You feel like you're alone in this, or like how do you like you used to have maybe your limb and then now like you've had a change and you don't know where to go. So I love that you have this source for people to go in and even for families too to like know what it's like and learn how to support and be there for those people who've suffered from these amputations or their differences that they've had. So I think that that is amazing what you guys are doing, and you guys even have a the state laws and all
Mhm.
that, and talking to your Congress people and like submitting all that. That is just incredible. You guys have like such a variety of like resources and a hub where people can go on. So, talk to me about how you're wanting to have this visibility have a positive impact in the future for everybody who is going through this and family members and just maybe who people who aren't going through this and them having knowledge of how to support maybe their peers.
So it's really I love that you're on the website. You found everything because
Yeah.
it's good. We have in here. We know there's a lot on our website, so it's great to hear that it was easy to navigate. And you
Yes.
could almost be giving my words for me. But the everything from the individual journey. So what you're talking about is when someone is wondering, is the way that I'm not walking today proper? Is this sore that I'm getting normal? For them to be able to connect with someone through a support group, through reaching out to us to understand that it probably is normal. It's probably part of the journey, and you move past it. This too shall pass kind of thing. And then taking that into the community and into access issues. So you mentioned So Everybody Can Move is our nationwide campaign. What you don't realize is that oftentimes someone who has an amputation, who has a limb loss, when they lose that, we think, oh, insurance will take care of it because we're used to that. And that's not always the case.
Mhm.
Some people get one limb for their entire lifetime. That's what insurance will pay for.
Wow.
And so what we're looking at is increasing access for those who to have more limbs, to do the things that they want to do, more prosthetic devices. If a child grows out of the prosthetic device leg that they have, they can't necessarily get a new one right away. If they want to play soccer, that's a different type of prosthetic device, and
Wow.
insurance may not cover it. So We are at the state level, as you mentioned, and looking at moving legislation forward across the country to improve that access and make it fair and equitable for everyone. You also mentioned my space is really the equity space and our Spanish resources. We also have a BIPOC support group, Black, Indigenous, People of Color support group, and really the disparities in amputations across Spanish-speaking populations and across Black Americans is vastly different than the rest of the population. And so we lean in especially to ensure that those communities have resources that are meet them where they are and help them to move along their journey in a way that is allowing them to thrive, as I mentioned earlier.
Yeah, no, that is incredible. I love the diversity in that you guys are here to help literally everybody who needs it. And I think that's incredible. I'd like to know, as a marketing aspect of this, how are you getting your name out there? I know you've attended like events, conferences, you guys have had maybe other interviews and all that stuff. I'd like to know how you're on your end, like maybe through social media or videos, how you're getting the word out there and sharing what you guys offer.
Sure. Every day where our most activity is, our favorite channel is Instagram. That's where the community tells their story. We have a We Thrive campaign, and so literally community members can come on and make their own video, or we help them, or we connect to them, and they share exactly what happened today. And sometimes the triumph for today is getting out of bed. Sometimes it's running their first 5K. Sometimes it's getting a running blade. Sometimes it's settling in a new wheelchair because they've had a setback or a difference or a choice. But they share whatever that experience is, really normalizing it and connecting with someone else who's going through the same experience.
Yeah.
Our other highlight is Limb Loss, Limb Difference Awareness Month, which we're a little bit out from, but we're already planning for. It's
April?
April every year. And in January, there's a toolkit that will be released so that everyone can help us share that word. And in January, there's also an advocacy toolkit because we have state proclamations. So we ask each state to proclaim April as Limb Loss, Limb Difference Awareness Month and help us
Whoa.
spread the energy.
Wow, you guys are like on that. I love that you have like a month. And do you guys hold events? Like, is everything online where you could participate and all that?
It is. It is. State resources are shared online. Things that we find out about are shared online. And then there's a toolkit that you can literally take resources, put it on your LinkedIn, put it on your Instagram, spread the word however you individually want to, or however people want to activate their support group, their hospital, their orthotic and prosthetic clinic. All of the resources are there to really activate in the month. Last month, I think, or last year, we had a couple areas, bridges lit up orange for Limb Loss, Limb Difference
Ah,
Awareness Month. We had community education days in hospitals, and we had people sharing more stories than ever in that course of that month.
love it. And I'd like to talk about the peer volunteer aspect of it. How can people apply? And is it only people who've had that experience who can help? Or can it be other people, maybe just as support? Or how does that work?
The peer support program is intended to people that have limb loss and limb difference. So you can apply on our website if you're interested in being a peer support volunteer. And those volunteers go through training. It's a formal certification process. And then they make connections through their local hospitals so that they can be able to connect with someone literally when they're in the hospital, when they've
Wow.
just gone through the amputation. Sometimes those are one visit, sometimes it's a relationship that lasts a lifetime.
Wow. And I also saw you have the option too if they wish to do like via Zoom or
Hmm.
video. So I
Yep.
think that is
Yeah.
incredible. Like you
Yep.
guys are really on top of that. Talk to me about any of the technologies that have improved the lives of people who are looking for limbs. Like, are you guys up to date on, I guess, like the latest advances for that and how that's helped you guys raise awareness?
It is. We have a strong relationship with the orthotic and prosthetic community, and that's where we can share new advances with community. Most of the opportunities that we're looking at and that we're sharing that people are really asking for are advances around pain. Normally, when you have an amputation, many people still experience pain from that limb that is no longer there,
Mm.
and so there's a lot of different holistic methods. There are surgeries. There's ways to share solutions with the community around pain. There's also what we hear always on the news is this new bionic arm, this
Yeah,
leg,
that.
this microprocessor knee, all those things. And we share those advances with community, but we're really on that side of making sure that when those are available, they're available to people who need them, and they're not exclusive to those who can. Some of these things are the price of a car or more.
Yeah.
And we really want to advance insurance and coverage so that everyone can access what they need in their life. Not everyone needs a microprocessor knee, but if they want it and it fits their activity level, then we want them to be able to have access to it.
Wow, absolutely. Yeah. No, that is amazing. And I'd like to know if you have, like, right now with our listeners, anything that maybe you would like for them to know or share or give visibility to. You have the floor for that. Even myself, I'd like to learn new information that perhaps maybe I didn't even know about.
I think we just went through the Paralympics and we had this great feature that we were able to do with a reporter who offered us an opportunity, and it was parents asking, "How do I talk to my kids about limb loss and limb difference?" And I would just encourage people to have an open conversation that many folks look to the limb loss and limb difference community as inspiration, and that's wonderful. That's very complimentary, but they're humans and not there for other people's inspiration, and so
Yes.
they're, ask people their stories, say hello. Don't Many of our community members say that the worst thing that happens to them is someone offering to help them in the grocery, and people mean well, but it doesn't come across that way. It makes them feel less than. And so I would just encourage folks to cross bridges where they can, to go on our website to learn more, to help people truly live in community as they want to, and not as inspiration for someone else or as tokenized or in a different way. And so that way that we can all live together and help people really thrive is would be my message, because that's the one we don't get to tell often enough.
Yeah, no, I think that is great. I think that maybe myself, when I was younger, maybe like 16, 17, I remember I was at a grocery store and I saw somebody who, in my mind, I thought maybe perhaps needed my help. And I offered, and they were just like, no, thank you. And I don't know why, but I went to my car and I cried because I felt like, and it was from a good intention. And I was much younger then. But you saying that, like, wow, like, absolutely, it can make people feel like, hey, I can do this. Like, no, no, thank you. And
Yeah.
I know they didn't mean anything from saying like no, I don't need your help or anything, but I don't know why I felt so touched, and I felt like I cried because I was like, man, I don't know if I offended them or if like I did something wrong. I don't know. I felt so bad, but I just wanted to share that's great for somebody else who maybe thinks that they you're not self-aware of those
Yeah.
things.
Yeah.
And so knowing the other end of that coin and how people actually feel about this is good. It's good to know. You learn and you grow. So
It's something to process and think about and to pause with right now. Why not just say a simple hello? And if someone needs help, they'll probably ask.
yeah,
Yeah.
you're absolutely right about that. And I would like to know if you guys have any plans for expansion or in any way grow or go to another, um, I guess, state, or like where's your main organization in? Like, is it in an office in a building in DC or?
So we're a national remote organization. So we have 24 staff and many volunteers who do this work covering the entire country,
Whoa.
which is not many people, and we're a very small nonprofit for all the work that we do. So we are trying to grow as quickly as we can. We will approach year end giving. We are a donor supported nonprofit, so we always ask for support from people, individual donations, company donations, to help move the work forward, because the 5.6 million people, that number with chronic disease is just growing. And so we're looking at how we can expand services as much as possible.
Love that. And now, where do you hope to see yourself in the next 5 years with the company, either with yourself or with a company that you'd like to share with us?
Yeah. I feel very blessed. My passion and my experience lead me towards turnaround organizations, and our organization had a tough time during the pandemic, both the pandemic and challenges internally and all those things. And that's why I was brought on board, because this is a space I enjoy. So I look forward to 5 years from now sitting up and saying, we did it, like with my board, with our volunteers, with our staff, and saying, this is the organization we knew we needed to be when we grow up, and we're there. And
Yeah.
so that's where my eye is right now. And I look forward to still be sitting in the seat and maybe give you an update.
Love it. Love it. I'd like to ask about what you guys went through during COVID. Like, how was that handled and all of that?
Being in the nonprofit space for 30 years, there are so many challenges that organizations are. So it takes a lot. It takes a lot of grit to be in this space long term. Our organization was founded in Tennessee, and they had just made the move to be a national organization, to move to DC. right before the pandemic. And so
Mm.
that coupled with the pandemic, with most of our service, I mean, peer visits, those are in person. And it just, we tried to do, the organization tried to do the best that it could, but didn't, came up short in a lot of areas, had some turnover in staff, and really just had to look at the core of what the work and reinvent itself a little bit. So not any one direction. I can tell you, I told my board when I first started, I said, there are many organizations that did not survive the pandemic, many nonprofits. It takes forward planning. It took a lot of things to be able to do that. So just the fact that we're sitting here able to rebuild is the positive momentum that we need. And never mind how we got here, we're just moving forward.
Yeah, no, I love that. And I'm glad that you guys were able to go through that because I know that was a very hard time
Yeah.
for a lot of people
Yeah.
and just like with all the change and, oh my goodness, but
Yeah.
we're here, we got through it.
4 years ago.
I know, right? And I'd like to talk about your team and what the dynamic is like with you guys. Like, are you guys constantly at events? Are you guys like in the board constantly talking about like, hey, I saw this come up. I think we should incorporate this. Talk to me about that. And are you guys very like comfortable with giving each other ideas, or is it more, I guess, strict where it's just like, no, we got to send it to this person first and then we'll
Yeah.
talk about it. Talk to me about
Yeah,
the dynamic.
Yeah. I have been very fortunate my entire career to have just amazing senior teams. Like my senior team, I think everyone on that senior team is more qualified in their space than I could ever be. And that's what I hire. That's what I like to cultivate as a leader. So there's, the senior team is all the directors and some of the other staff. And that's where we look at the future of the organization. That's where we're doing our planning. That's where we want to set up the recurring things like you're talking about. There are things that we do on a regular basis that we're looking to grow, that we want the systems to make sure they operate effectively, that we can answer calls when we need to, that we can support volunteers, that all those things are structured. But there's also that space that's emergent, that can we all hop on a call and figure out how to take advantage of X that just got offered to us yesterday. And so this team that we have in place right now really is able to do that. We were just together about a month ago in Colorado Springs. I said I kidnapped everybody for 3 days.
Kidnapped.
And we kind of just all got on the same page, both like energy wise and planning wise. And I really think it's the dream team to move things forward. Like I couldn't be more excited about the folks that we're planning with at the senior level right now. And then everybody else is they have the same level in their individual teams with managers and coordinators and specialists so that they can move things forward in the buckets of the organization.
Love it.
Yeah.
And now, when you're not out here giving visibility, providing resources, what do you like to do as a person yourself? Or are you always like just so busy that you can't find time and you're just like, talk to me about that. I'd like to know.
I don't sit still well, so that's advantageous for my career. But also, I have 3 kids. I have a 13-year-old, a 16-year-old, and a 19-year-old. So
You're
an
busy.
eighth grader, a junior, and a freshman or sophomore in college. Also a husband, so we are a very active family. I'm a soccer mom who's one of those crazy people that travels around the country for soccer games.
Love it.
And I wouldn't change any of that for the world. I had my family later in life, and that gives me the spirit and the love that I need to do the things that I enjoy doing every day. So it's a balance. I don't rest much. I don't require much sleep. That's not a good message for sleeping, but
Hey, everybody's
I'm
different.
good with 7 hours. And if I get 6, that's fine too, if it's an exciting day. So yeah.
If it's an exciting day, I love
Yeah.
that. No, but I love your spirit, the positivity that also really helps, and it's contagious. So that 7 hours is doing great for you.
Thanks.
But if you ever get more,
Yeah.
enjoy that. And now talk to me about your website and how you came to finding all of these resources, because I know you have like some articles. Do you have anybody who you've hired to help keep up with all of that and like just constantly post it, or is it like a team effort where everybody's looking at the latest things where it's like, hey, we need to put this on the website, this is like something important? Talk to me about how that process is for updating the website and like all the resources and like tabs. I'm sure when you add to that, is there somebody behind the scenes who's doing that? Or
So yes, there are resources that come out in the field, and so we recognize that these need to be shared, and that's really our communications and programs team, and they are vetting them to the best that they can based on their experience and knowledge, and then getting up there and out as quickly as possible. And social media is really such a blessing in that these days. But the ones that we develop, there's just a really special group of leadership volunteers called the Scientific and Medical Advisory Committee, because these things don't just exist. Any of the resources, how to, if you're an above knee amputee, below knee amputee, those are completely different journeys. Upper limb is about 20% of the general population of amputees. That's upper limb, so very small. But that Scientific and Medical Advisory Committee develops those resources. So last year we released one of the first ever guides on intimacy and sexuality. And that
Wow.
was developed by subject matter experts in our Scientific and Medical Advisory Committee. And that has been a resource for the community that just didn't exist before. So
Yeah.
that's the really special places. There are people who are choosing, those are volunteers that are leaning in with their time and expertise to create something that they know is needed. And those gaps are informed by ongoing communications with our community. So they say, I need more mental health resources, or, there's a new prosthetic device that's available. We might do something about that. There's osteointegration, which is actually an insertion into the bone rather than a prosthetic device.
Yeah.
And so we've created new resources around that to help people understand what that's like around the world, because in the US, it's a new market. It's a new opportunity. So always looking at those, with the volunteers and staff really leading that way.
Yeah.
Yeah.
Okay. Sounds like you guys are on top of that. So that's amazing.
It's a
Good.
lot. It's not my area of
Yeah.
expertise, and we've got all the right people leaning into it, which is really special.
Yeah, no, it takes a team to,
Yeah.
make it all work. So that's amazing. Have you guys considered going, or I don't, maybe you've already done this, but going to like schools too and like giving like conferences or speeches or like something interactive for the kids to also know? Because I'm sure like it's tough for like teens or kids
Yeah.
in school with that, and they're like growing up, and I'm sure it's not an easy thing for them to do. And I think it would be, in my opinion, kind of cool and eye opening to have you guys go to schools and just talk about it a little bit.
We do have a youth engagement program, and we have a youth advisory group. So these are young people and young adults that are living with limb loss and limb difference, and they are some of the most dynamic, huge personalities that are just paving the way for people to understand their journey. So whether it's Henry at a basketball game, telling people how it's different, or Divine is a new university student. I think she started a new club at her university. They are making an example by their life, and they're, crossing bridges and helping people understand what it's like, and what they need on a daily basis. So we want to reach out to the community members that are youth and young adults to help them move forward in their lives. We don't have the capacity to be out in front of everybody else right
Mm,
now, but we, really hope by developing the voice of the young people and young adults, and enabling them to have those channels to be able to do that sets it forward. And then maybe we'll get to a day when we're bigger and we have
yeah.
larger campaigns and can reach out to everyone else. But I think they might get there before we do
Oh
anyway.
wow. No, that is great that you guys are like working with the youth and like inspiring them, and they're going off and branching
Yeah.
out and helping. That's like such a positive impact for the community and for just like society in general, and I just think that that's incredible. You're leaving those positive impacts on them so strongly that they're just like, I want to share this information. I want others to have the help that I did, and I'm sure they'll shout you guys out too, so those people can come and get all the resources and help from you guys as well. So amazing. Um, I would like to know if there's anything that maybe I'm not touching on or haven't mentioned that maybe you would like to share with our audience. Maybe any upcoming events or workbooks in the work, anything of that nature.
Um,
Just want to make sure, like, while I have you here, we get
I
everything
know
we need
you've
to.
hit on almost everything that, I think as we lean into this next year, we are just looking forward to more of all of it, to more of support, education, advocacy. The organization we've really honed in on that as our foundation. So our support programs, our peer support programs, our um, support groups, those are foundational to the work that we do. There was a period in time where the organization wasn't sure if they were keeping them, and I just want people to know that they are. They're not going away. They're growing. That's our focus. We have realigned our staff to be able to lean into that more, to look at technology, to look at solutions to grow. And I think that's really exciting, as well as education and advocacy that we've touched on as well. So we've hit most everything.
Yeah, no, this is just incredible. And is there like maybe somewhere where people can reach out to you guys on your website, or do you have a particular place where it's like, no, contact us through here that you prefer?
Yeah, so the biggest thing is we are a federal partner with the Administration for Community Living. And so we implement the National Limb Loss Resource Center. So the best way to connect for resources, for peer support, for anything that we've talked about here today is the National Limb Loss Resource Center. And that's on our website at amputee-coalition.org. Instagram also, we are very active on there, and for professionals in the orthotic space and the prosthetic space, and professionals who are living with limb loss, limb difference can always connect with things on LinkedIn as well.
Beautiful. And if there are maybe like doctors or other people who maybe would like to like sponsor you guys, they can reach out to you guys or help or be a partner with you guys, they can reach out.
Certainly, any clinics across the nation, any hospitals, any providers that want to have our resources, that want to connect with the things that we have to offer, we are always available to partner. We do everything through partnership.
Beautiful.
Yeah.
And now for my last question, I like to ask this for everybody is do you have a quote or a saying that maybe has inspired you in your life, even outside of where you are today? Maybe growing up, you heard something that really touched you. Could you share that with us?
Oh wow. I think that the biggest thing is, and it's so simple as this too shall pass, and it's not just for the negative spaces. It's knowing that the joyful things that happen in life, to be present for that, because they won't last either. So it's like good and bad, and so I do find myself like often I'll grit my teeth or I'll smile. I'm like, this too shall pass, and it's good and bad, and
Yeah,
I think that's just the reality of life. That change is always around the corner.
I agree.
Yeah.
Well, thank you so much for being here and giving us all this insight and information that I was not even aware of. Like, I hope today that our conversation has inspired somebody and to look up more information and look up you guys and just learn. So, thank you so much for being here.
Awesome. I appreciate the opportunity. I love it. Thank you.
You're welcome.